It's Liz Posen, clinical psychologist, Melbourne, Victoria. I hope you're well and keeping safe. It's March 30th, 2020. In Australia, it's a rather momentous day. I say Australia because many people who are going to be watching these videos have subscribers to my YouTube channel where I help people with anxiety and fear of flying, a variety of things, and they get, because they're a subscriber, they'll get this video. So I want to say to you in particular, there'll be other videos to come about anxiety and how to manage it during this difficult time. This video is going to be on my YouTube channel. I don't want to create separate ones. And the video you're about to watch is about how psychologists can work within the telehealth system here in Australia. Stick around and watch it if you like, but it really is aimed at psychologists. So if this is not your interest, I'll be sending you another video soon. Now, why is this day important here in Australia? Well, it's because this is one of many times when we're going to see changes to the Medicare system where people can access psychological services via these technologies, video conferencing. Last week or the week before, because I was in a vulnerable group, I was able to get a little bit of a head start and bulk bill people. Even for a start, one of them was quarantined, having flown in from Australia, but then there were others because I'm vulnerable. They're not. I could start to bulk bill them, and now, as you will know, March 30th, all Australians can access all psychologists of their choice, no matter what state they're in. It's open slather. There's a large government incentive now to do so for both GPs and for psychologists. So I'm going to guess that some of you already are bulk billing through your services. You've always done it. Well, things are a little different now because you can't get your patient to sign a document. It's a little different. You're going to have to do this all online. Some of you are already using services which allow you to bulk bill. They'll do all the heavy lifting for you. Services like Halaxy, which used to be HealthLink, and Power Diary, based out there, I think in Bendigo in Victoria, and there's also Core Plus, also here in Victoria. There's a variety of systems which will do all the heavy lifting for you for a small payment, a percentage or $1 here or there, whatever, and so it kind of adds up, but they'll do it for you, saves you a lot of time. Me, in my entire history of working as a psychologist, since Medicare came in for us in 2006, I've probably bulk billed a half a dozen times for only a very small number of patients, and it's been the old triplicate paper system where I had to fill in everything by hand in triplicate and then post it to the local Medicare office. In the last several years, the federal government has decided that's a pretty lousy way of doing things, so now we do it online. So I'm going to show you two methods of doing this online. For those of you who are new to bulk billing, you've never had to before, now you're trying to figure out how to do it, you don't necessarily want to join a system. So here is how we do it. Number one, you go to the Services Australia webpage. You can see it up there now, servicesaustralia.gov.au. Okay, servicesaustralia.gov.au, and up will come this page. There's a variety of things to look at, and so let's have a little bit of a look-see at what this page holds for you. So if we sort of drop down a little bit and scroll down, as you'll see, there's a variety of sections there, but you will get to this page, or this area on the page called HPOS, which is Health Provider Online Service. And if we click a little bit further down, we go and have a look, you'll see there are a variety of panels, and you can see the login one. Okay, log on to HPOS, and there are several ways to do this. Just bear with me, let's keep going. So HPOS, and now you have the login. You have PRODA, and you have PKI certificate, and you have other things. We're going to focus on PRODA, okay, this one. So we're going to click on that, and you're going to see what happens next. Now, what happens next, on my Mac, automatically my username is available to put in. Now, I've blurred it out because I don't want you to see it, but if you have a look next to the username, you'll see there's a fingerprint, and it's this fingerprint here, because on my Mac down here, where I log in, I just have to touch it with here. It's a fingerprint login. Okay, this is on the newer and slightly more expensive Macs. Otherwise, you simply will type in your username. But what this one also does is it will automatically put in my password, which is long. I don't have to remember it. That password is in a keychain encrypted on the Mac. Okay, so let's continue on, and we'll put in my username. And notice now that the password is automatically popped up there, but it's just in dot form, so if anyone's looking over your shoulder, they can't see it. There is a section there where you can hit show, so you can see for yourself it's accurate, but most times just it's done. And then we're going to hit login, and up will come the next page, which is enter code. Now this is a two-factor identification. It's like what banks use. So you've got username and password. That's one way to get in, but in order to completely get in, you now have to have set to a separate device. In this case, it's my my iPhone, which also then duplicates onto my watch, by the way, and it will put in a 6-digit code. Okay, that's what it's going to do. So I'm going to put the 6-digit code in there, type it away. Notice that when I do type it away, it's going to be just in dot format, not the number format, again, just in case someone's sitting over your shoulders. So we're going to hit that and then hit next, and it will take me to the beginning of putting in my data. So now we can see a page. It looks very Windows-like, Windows 10, doesn't it? Not much imagination shown there, but anyway. You have several options here. You can find a patient, so you can look up their records, just see how many accounts they've put in from the previous work. The one we want to look at is the sort of orange one, which says claims. So we're going to click on that, and up comes this page. Very simple. I like it. It's very simple. Either view saved claims, so you can go back in and see your previous work, or what we want to do is make a new claim. So make a new claim. There are several choices there, not that one, but that one. Medicare bulk bill claim. And now up pops the first of several steps. And the several steps are, firstly, find a patient. And you'll notice here that we have a number of fields. Some are open and some are drop-down choices. But all of them except for one, date of birth, have a red asterisk, which means it must be filled in. It must be completed. You can't leave it blank. Okay, otherwise it will stop you from going further. So under the search type, where it says Medicare patient, you have here, if you click on it, two choices. Either it's a Medicare patient, their green card, or it's a Department of Veterans Affairs patient. You make that choice as to which one it is. Okay, so we're going to choose that one. Or here, you can either use their Medicare card details. Let's just imagine you've had them on the referral. You've still got the referral and it just happens to be there, or you ask them for it. And or, you can see the second drop down, you can use the patient's name and date of birth to verify it. Okay, so these are the two details that you'll need. The second one, the Medicare number, you'll see in a moment. You actually need the patient family number. So if it's a single person, it'll just be one, but it might be the third daughter of the family. It might be then number 5 or number 4. Let's proceed, and you'll see what happens next. So in my case today, we're just going to use the Medicaid card details. Now I'm going into my browser where I keep that patient's details, and I'm going to pop it in a moment. So let's type in the Medicare card number, and you'll see how this works. So now I've just put the first number in, and then I've blocked everything else out, and that's because it doesn't hide it. You can see now the next parts, first name, which I've just put the initial in, and now the date of birth, which we're going to put in next. And now you will notice that there's a tick box there I declare that I've obtained the patient's consent to perform this search and or this billing. Now, because they're not face-to-face with you, you have several ways to do this. One, you get them to send you an email. I consent for psychologist XYZ to access my Medicare data in order to bulk bill me, or I give my psychologist permission to bulk bill me. You must get that either email, SMS, which you need to get off your phone and put into their file somehow. Take a screenshot, it's the easiest thing to do. An audio recording that you've made of them saying that to you, or when you're in your first video conference call, you can record the first several minutes. Skype, Zoom, FaceTime, somewhere along the way you'll be allowed to do, you'll find a way to do this, and just have that little recording. You've got to keep it for 2 years, by the way, okay, just in case you get audited. Next part, you've filled that in, you've ticked the box. Let's move on to the next section. And what it's doing now, you can see here the details submitted have been confirmed as correct. So once we've done that, the system goes and does a little bit of a search, and if you scroll down here a little bit further, you will be able to see the results will pop in, and you'll see there they are there. And again, I've obscured the results. What you will get is the expiry number, so I think I can leave that there, not identifying my patient. And that's what you're looking for. Results 1, just make sure that's the right person. And now we proceed with next. And now comes the next serious part of this, and that's fill in provider details. Okay, so what we have now is the patient's first name, the patient's last name, their date of birth, their Medicare card number. Now comes your details. Notice again there are actually four asterisks. You must fill these in. The ones pertaining to you are your service provider number. That's your Medicare provider number. Notice that because I've logged in under my HPOS, it's already there. So we click on that. I have 2 locations, so I click on that one. I don't mind you seeing me, it's out there in the public. Is payee provider same as servicing provider? The answer is yes. Not a hospital claim. And we go to the next section. Service type, it's Allied Health. Here, the drop down, so you just confirm Allied Health. And now you're putting in the date of service. These are open fills. Notice again there are several asterisks. You must put them in. This one was done a couple of days ago, so it's already gone in. Referring provider number, who is the doctor who referred this person to? There's the doctor, the psychiatrist. You're going to put in their names, their details. Again, the number isn't covered up, and you're going to put that in. All the several providers, you can do a verification there, but it'll come back. You now need to put in the date of the referral, and if you've already been doing ordinary invoicing, you'll be familiar with that. This has to go onto the referral anyway. Now here on the online, you put it in. Next part. You will see item number, benefit assigned, was a duplicate service. These all have to be filled in. Where it says was a duplicate service, well, we'll get to that in a second. Where it says what's the item number, this is where you'll need to look up all these new item numbers that start for psychologists with a 9. So I'm going to type in the service number for this service, which was a 50+ minute video service. So we're going to type that in now. You might as well have them all printed out and sitting by the side or on a note somewhere so you can recover them. So you're going to put in the appropriate item. You need to know what the claim amount is, by the way. So you're going to put in not just the item number, but you need to look up what the claim number is, what the item rebate is. It's going to be the same rebate as it was before. Okay. So for me as a clinical psychologist, it's $126.50. Where it says was a duplicate service, notice that there's a mistake here because I left in no. here, that little section, because I didn't put any information, go up to the top where it says, where it's blank. Leave it blank. Not yes, not no, it's blank. There's 3 choices. Leave it blank. Now it's review and submit. Read through and make sure all this is correct. The patient, the doctor, and now this is your legal requirement. You're going to hit the tick button for provider declaration, which is where you're going to send this thing off. So let's go forward and do that tick. And now you have a second one. You need to read through all of that. And now it leaves you with the bulk bill claim form, which has a benefit of this. And what would you like to do now? You can make another claim for them. You can't just put half a dozen in one go. You've got to keep on going. Okay? And there's a variety of other claims that you can do too. So I hope you found all of that useful. It's quite laborious, isn't it? But it's not tedious. Once you get into the workflow, it'll just happen. I'm using this because I want to save money. I don't need to purchase practice management software or purchase a service. I've been doing this a long time, so I kind of know what I'm doing. If on the other hand you feel totally lost, then yes, pay your money, get a practice management software, join up to a team of people who are doing this, spend a bit of money. I'm going to do some more videos like this. There are lots of little things that I've learned along 10 years of doing telehealth, unsupported by Medicare, just on fee-for-service patients. And I'm going to help you out a little bit here with with the knowledge that I've gained over all these years. There'll be more videos to come. If you're a subscriber to my Fear of Flying, my anxiety videos, there's going to be more for you coming along as well very soon. We're in a new world here. Let's not grumble and gripe, but let's just try and find some new solutions, and maybe, who knows, at the end of it all, we'll come out a different society, that's for sure, but maybe we'll learn something about ourselves too. Bye for now.